I'm Ronit Adler, MD. I am the chief presently of pain management at Brookhaven Memorial Hospital. I opened about 21 years ago and have been practicing consistently during that period of time. The thing about it is that it's been such an evolving practice. It started out with just basically doing a lot of Botox and some facial fillers, and it's evolved into a lot more things, including Smart Lipo MPX. I also have the triplex machine, so it's really been very evolutionary. What I pride myself most about is the fact that I think I'm very artistically inclined. When I look at a face and I look at the structure, what I try to capture are some of the things that I may find a little bit deficient. For example, if it's an older woman, what they do is they chase wrinkles or lines. What I like to do is to restructure the woman's face or add volume to it in certain locations where collagen may have become depleted. And that really gives a very refreshing and natural look as opposed to artificial and windblown. So having an artistic background and an interest in it has really made me very unique in that a lot of times what people do is they try to volumize somebody based on what they do on one side, they're going to do to the other side, and nobody's face is really symmetrical, and you have to really look at a person's face and see where you're going to make the most amount of corrections. How that benefits the bride and the family and the whole bridal party is that each person is individually looked at. So for example, if it's a young bride, she may need some buffing of her skin, more so than, for example, lines or wrinkles being addressed. So what we do in a case like that, she can have a very exfoliating peel, or she can have a very refreshing type of facial that'll give volume back to her face and make her look very refreshed and new. Also, I offer mesotherapy, which a lot of models do right before photo shoots. What that is all holistic products, vitamin A, vitamin C, hyaluronic acid. It's all naturally occurring substances that when given through the skin give you a very, very buffed and fresh look. And that's excellent also for photo shoots as well as just looking very natural to the camera. It's an extremely, extremely successful procedure, and in Europe, everyone does it. It's very highly frowned upon now to really do anything exotic or surgical to your face. And I believe in that. I want to do as little surgical manipulation. I would much rather do sort of holistic treatments or treatments that aren't going to really change the way you look too much, just give you a fresher look. If you're going to come to the services here, I really prefer that a patient come to me or a client comes to me about a month in advance. That gives me kind of a lot of flexibility to really get them primed and to look their optimal approximately a month later. Also, you really have to have an extensive history of a patient. You don't want just someone who comes in through the door. I'm very safety oriented. I never want to do any harm to patients, especially in an event like that. So it's very important to have a clear history of the patient's medical history. For example, someone who has diabetes or high blood pressure or other thyroid disease. Those are very important when you're assessing a patient. You don't want someone to just walk off the street, say, okay, this is what we're going to do, and you know nothing about the patient. Even caffeine intake is important. If somebody's basically a very healthy patient or isn't on birth control pills, which a lot of people, you really have to think about that as well, that can cause some issues, and you want to make sure that you have a very clear understanding. And when you come to the doctor, especially to my office, I'm very interested also in homeopathic things that people are taking. People think that if it's homeopathic or holistic, that it really has no effect, but it really does. And so I also took a lot of time to learn all about homeopathics because, again, it's a growing trend in our society, and I adhere to it myself. For example, I do use arnica as a substance which is holistic to help somebody with bruising so that they don't get bruising, and products like that, it's very important to know if patients are on those kind of things. So what a bride should do is get a very complete history of any medications that they're on, including homeopathic substances. Absolutely mention if they're on the birth control pill, that's also very important, and any medical problems that they might have. So the history is the most important thing, and then you can structure their therapies accordingly. When using substances such as Botox, what you want to do, again, you're not chasing lines. So for example, if you want to contour the bride's eyebrows, for example, to have a little bit of a lift, let's say their eye looks a little saggy or they want a more opened eye look, I can do that. I can use the products that we have available now, for example, like the Botox, to curl your lip up a little bit. Not give you an artificial lip, but sometimes by very simply placing Botox in very strategic locations, you can give people a beautiful, beautiful look, and again, very natural. Nobody would even know that it's there. Laser hair removal can be performed before the event as well. It's not going to be permanent unless you do the 5 sessions, but it's definitely going to give you a lighter textured hair. So people who do have issues with, for example, sideburns or, throwing shadows because of their hairline, the lip line, or they have facial hair, it could be easily worked on to make you look much smoother, as well as people who have acne. We have an unbelievable mechanism for clearing someone's skin, but again, I do usually require about a month so that we let you get through the process without any downtime and without any issues for the big event. What we basically pride ourselves here is that we look at the person as a whole. We don't look at you as a wrinkle, as a stretch mark, whatever it is. We will contour individual therapies for each individual person. What does that mean? When you walk through the door, we will look in the mirror. It's a cooperation. You tell me what you're interested in doing, and I will tell you my input if you so desire. And together we will structure a treatment protocol that'll make you look the best that you've ever looked. That's what I pride myself on. And whether that means that just a simple facial or a makeover or laser hair removal or facial fillers, Botox, whatever it requires, or even smart lipo, it's all available here.